Yes. Good
yes.
evening. All other people are watching through the YouTube. Good evening. Hope our audio, video, everything it is visible and audible. So today, we are discussing about mental health nursing for the second year GNM students.
Yes.
Second year GNM students and also BSc students, GNM students. What are the concerns you have regarding the examination, including practical examination and theory examination? Just write it in the Instagram page or otherwise in the YouTube comment section.
Yeah.
Okay, so we are here for addressing your concerns. So yesterday also we had the classes. I hope that will be useful. And the day after tomorrow also we had the classes. And most of the questions that came from that class only.
Yeah.
Because GNM exam and also the BSc examination, first year BSc examination, behavioral science. Behavior science, bioscience. Bioscience.
First year GNM.
First year BSc, anatomy physiology. It was little bit tough. Almost the students are telling like that. So don't worry, it is a professional course. The examination, university examination, it is like that only. Okay, so if the examination it is difficult means we can expect a liberal valuation.
Yes.
Is it?
There is a chance to get a bit of liberal evaluation.
But the problem is that two evaluation is there. So first evaluation and second evaluation is there. The evaluator, they don't know each other. So there is too much mark changes means again it will go for the third evaluation. So that is the reason usually that much of liberal we could be able to expect because this is a university examination. Anyway, the exam it is already finished. So again you are concerning with that one and
overthinking it makes you to be
about that means what do I give him? Okay, so that will make a confusion only. So anyway, what are the exam? It is finished. Just to leave that one and focus on the next examination or the practical examination. Especially anatomy, physiology, practical exam it is not there. So focus on your practical examination only. For the GNM students, how was the exam? Tomorrow's exam, that is mental health nursing and FON. FON class is there. But next MH and revision. Mental health nursing. Mental health nursing revision, it will be from 6 to 5 to 6. Within 6 o'clock we will be finished the sessions. Okay, so any students have any doubts, just chat here. Almost this is a supplementary examination. Only few students are comparatively writing the examination. So that's why mostly they are aware about that supplementary exam. So when was the first sem result? First semester result August 15.
Once everyone's practical
once the practical examination will be finished, your result.
Your results will come. Okay.
Because valuation it is already started. Almost it is the end of the valuation. So mental health nursing, we can start with the mental health nursing. Don't worry. Other students, practical examination students can also write it in the comment section. So we will address you. So mental health nursing for the GNM second year students. Total, what about your mental health nursing practical examination, where it is conducted?
In college.
In college
centers, only. Certain centers will be available. So according to that, already center list has been released. Okay. So according to your college, certain centers already released. According to that, you will get the college and you are going to write over there in the center.
So same like a GNM, what about their units? Simply we will tell you the units because this is a supplementary examination. Again, too much of explanation means last day the GNM first year we conducted the live session. So in that one comment I saw that one. For getting important questions, we can just search it in the ChatGPT like that.
Okay.
So then my question is that why you are studying simply search in the ChatGPT? No, everything it is not like that. We are telling based on our experience.
See, actually, one
you
thing
can
I want
use
to
the artificial
clarify.
intelligence, everything you can utilize that one. But I think now also at 2026, 29, 7, now also it is not possible to replace as a human being with the AI. Okay.
Actually, one more thing I want to clarify. Yes, you will get in the ChatGPT. No issues. But why you lost the first attempt? So that strategies we were telling in this. ChatGPT will not going to tell you that. Okay. So those strategies we were experienced from the students. So that is what it is okay. And you have to get the knowledge, which is how to tackle the
you
exam.
can focus on the ChatGPT also, no issues. But anyway, you have to follow the textbooks. Textbooks, you need the reference with the textbooks, and at the same time use other alternative methods like ChatGPT or Gemini, whatever you have, you can utilize that one. But never ever you couldn't able to replace as a teacher like a ChatGPT.
That's what I tell you in the live itself, ma'am.
Maybe that is the situation, current situation. Maybe in future it is possible. Okay, next year
AI
also it
teacher
may
will
be
come.
possible. Robotic classes it will be there. It may be there in the future.
God
So we
grace,
can
it
also
should not be
expect that one. But so current situation you should, because in the Viva session it will be conducted with the teachers only. Okay, so in future it
Yeah,
will
may
be
be
conducted
conducted
with a
with a
robot,
robot.
with the webcam.
Yeah.
So suddenly they will ask sharp questions. Students needs to give the correct answer.
answers.
Otherwise, wrong.
Yeah. Everywhere digitalization will be there. No, in your exams also it needs to be included. That time you come to understand how the teacher and what is the importance of the
And
teacher.
also robotic surgeries are there. So
Yeah.
teacher can also replace with AI.
Yeah.
But what
Already
about
so
our
many
job?
in Kerala already came.
Okay, so mental health nursing, if you are thinking about this one, our mental health also will go. Okay.
Yeah.
So result within this month, within August, you will get the result. Okay. So first chapter, that is about the introduction chapter. It is describing about the concept of mental health and mental illness in relating to providing comprehensive care to the patients. Mental health nursing, it is related with the disorder, psychiatric nursing.
Yes.
So that is the reason, easy tip, wherever you are not aware about the exact answer, means add some gas, professional gas. What is that? You can add some nursing care, management, and some patient consideration. Or
Actually,
like that.
same like what we have studied in the MSN, the paper writing pattern is there. No, you have to bit of things you take from there. Okay, the modality, how to write the disease condition. Okay, psychology is a different. Psychology are going to study about the behavioral things. Okay, so mental health nursing is completely about the disease condition and the disorders which is affecting our mental health. Okay, so nowadays it is one of the hiking thing in India or worldwide. Okay, so everybody were got mentally because of due to stress, lifestyle, lot of things. Okay, so
so in the first unit it is talking about the concept of mental health and what is mental illness. Then it is talking about the principles of mental health nursing and the definition and the terms of psychiatry. And then review of defense mechanism and mental health team. Mental health team, it may be a 5-mark questions. Mental, and also define mental illness, compare and contrast between mental health and mental illness is an essay question. It will be a essay question.
MHN revision, somebody.
Mental health nursing
this
revision.
is MHN revision.
Mental health nursing revision. Okay, then principles of mental health nursing, it is also an essay question. Principles of mental health nursing.
Togetherly they will ask, okay, define mental health nursing and explain the principles of the mental health nursing, elaborate the answer with the mental health nursing team. Okay, so 7 marks question part is there, no, longest setup. There you will get this kind of questions. Okay.
Then mental health programs that is not the first unit. Then also mental health programs will be expect. Then 5-mark question, that is mental health team. So what is mental health team?
Okay.
It may be essay question or otherwise a 5-mark question. Mental health team means that will include different person who are going to treat a mentally disabled person or mentally challenged person.
Yes.
Okay, so that are include a psychiatrist or psychiatric nurse. Third one is a clinical psychologist, a psychiatric social worker, and sometimes occupational therapist. You can write that one. Remember these points. Tomorrow's examination, you have to remember these points. A pharmacist and a dietitian and a counselor. Okay, so that is also, they can write like a
flow chart. Okay, so use like this. Okay, who will come? Clinical psychologist. Okay.
Yeah,
Next.
we can tell the answer shortly. Mental health team. Mental health team means that include various person. That persons are going to give or specific services or treatment or services to the patients. Okay, so that is also we can consider like that multidisciplinary team include a doctor, that is psychiatrist and a psychiatric nurse, a clinical psychologist, occupational therapist, pharmacist or dietitian, usually one dietitian and one counselor. So various method you can do this one. Again we are going to explain in a time problem. So you can explain that one.
So
Okay.
you can see this, okay? So your chat GPT will not going to tell about the schematic representation, my dear students. Use different things of schematic representation.
If you
use like
want different method means
you
you
can-
use ChatGPT, they will
will
show
show
different method. No problem. Okay, but we couldn't able to tell to replace
Please,
it.
yeah.
Okay.
Can you tell the answer shortly?
Answer already
Yes,
we
yes.
done.
We are telling the answer shortly because we are not focusing on the elaborating answer. We are only focusing on you to give the important question, get pass in the examination.
Yes.
That's it.
Then that is about the first unit. Then we can move to the second unit.
So first unit you already know the major important things whatever ma'am told, no, that only focus. More than that, don't do waste in the first unit. Okay. Next.
Then what is psychiatric nursing, everything you have to remember. And the different classification of mental disorders is there, that is also remember, because mental health nursing, it is important for the GNS students.
Okay.
It is not a simple subject.
Second unit is that history
Defense
of
mechanism is one area they are asking for the GNS students.
Short
Defense
notes.
mechanism are the methods of attempting to protect self and cope with the basic drives or emotionally painful thoughts, feelings or event. That is known as defense mechanism. So defense mechanism, some problem is again that is going to diseases.
Defense
like
mechanism,
stress.
you know this, no, adrenaline rush. You see, if a fight or flight, that mechanism, you know, if something suddenly snake will come, me and ma'am will run away from here without knowing us. Okay, so that is how it will be going to be affect. Okay, so that is the defense mechanism. Hope you got this.
Principles of mental health, concept of mental health nursing, that is also you have to remember. Then the second unit, that is about.
Yeah, so the second unit is all about the history of psychiatry. Okay, so the history, there is always the trends and all will come. That is very important. Trends in the psychiatric nursing. Okay, National Mental Health Program. This is very much important, and how the era of psychiatric nursing has been started. Okay, in the pre-independence and all, the mental people were not going to be treated properly. Okay, later on course they have got initiative and all, they have opened the specialized hospitals for the mentally ill people. Okay, these are the story. Okay, so that is how this history you give a importance, but even though you have to provide a importance for the trends in the psychiatric nursing, and as well as you have to focus more on the National Mental Health Program, when it was started and when we are celebrating every year, and as well as what are the objectives of
1
that.
mark or 5 mark questions
5
we
mark.
can expect.
5 mark.
So then about the third unit. The third unit, mental health assessment. Mental health assessment, in that unit it is it needs to describe about the mental health assessment, that is MSc, mental status examination. So mini mental status examination and mental status examination you will get like a 5 mark questions. So or 3 mark or 2 mark questions it will be there. And then
Short note.
Okay, then psychiatric history taking and the mental status examination is one of the important area. And in that, interview technique is also one important area. Okay.
So certain interview techniques we used to use. So those techniques you have to study and write it down. Okay. So and next in this particular thing, MSc. Okay. So MSc means mental status examination. Okay. So that is also very important. So that you focus more. Okay. And the remaining and all, how we are collecting the history and all that modalities will be there. No? That you can easily write it down for this.
Then mental status examination from the unit number 3. Just read that one. That is enough. Then unit number 4.
This one you have a practical exam, no? There it will be very important for you.
Only that is the main questions you will get. Okay, then the next unit, that is 4th unit, it is talking about the therapeutic nurse-patient relationship. What is therapeutic communication? Therapeutic communication is an interpersonal interaction between a nurse and a patient during the health treatment. That is therapeutic therapeutic communication. So in that therapeutic communication, talking about the therapeutic nurse-patient relationship, that is also sometimes like an essay question.
Interpersonal
It will be
relationship.
get,
Okay, so interpersonal relationship, which means treatment. Okay, so in during the treatment period, whatever the relationship the nurse has to build with the patient, that is called as a therapeutic nurse-patient relationship. Okay, so that you have to study and go.
Here, therapeutic nurse-patient relationship definition, components, phases, and the importance of therapeutic relationship. These are the important area. Then, other than that, communication skills, define elements, types, factors influencing communication, and communication barriers.
Yeah.
That is another sections are included in the unit
That
number 4.
entire that communication process is there, no, that you include here also, and as well as write about the barriers. Barriers are very important, focus over there. And we will move towards the 5th unit. Okay, so the 5th unit we have that mental disorders and nursing interventions. Okay, so this is one of the biggest unit in your subject. Okay, so
Yes.
here the actual mental health nursing will start.
Regarding disease condition area, here psychopathology of human behavior, then some etiological factors. Etiology, what do you mean by etiology? Etiology means mainly that
Causes.
is causes, reason. Okay, reason of the disease, that is etiology. Basic etiology is unknown, because why we don't know not only we, everyone don't know the reason of disorders. So etiology means what may be the reason of this particular disorder. Then classification of the mental disorders related with the thought, motor activities, and mood, speech, memory, everything that is included in the unit. That is actually a 24 or 25-hour unit, a big unit. So here we need to expect a essay type questions and a short answer question.
And 1 mark, meaning the following, and fill in the blanks. Entire paper will be going to be cover 1 main also 1 questions we can expect. Okay, especially they can ask for the meaning, schizophrenia, define schizophrenia. You have to tell about the time.
And here I forgot to tell you that in the unit number before the previous introduction unit, ECT is an important area. ECT is an essay question. So essay question, it will be get like that, define ECT.
Indications and contraindications, and explain the role of nurse in the ECT. Okay, so that is very important.
Otherwise, simply like a 1-word question also, it will get like, what is ECT? ECT means electroconvulsive therapy, ECT. So electroconvulsive therapy means is an artificial.
It is an artificial therapy or the induction of the grand mal seizure through the application of electrical current to the brain. Okay, we are inserting the artificial grand mal things through the current, through the electrical current charges. Okay, so that is how we are.
2 types of ECT are there, that is direct ECT and modified ECT. Then the indication of ECT means where we are using this ECT. Major depression cases like suicide risk, then stupor, then different major type of depression, and severe catatonia like schizophrenia, then severe psychosis, organic mental disorders, and some other indications also is there.
Give some points to be right. Okay, we are giving the.
Okay, then contraindications and indication of ECT is a question. So contraindication are raised ICP level.
Yeah, intracranial pressure will going to be increased by the time. Okay,
so that will, if a person have a raised ICP means they couldn't able to do ECT, that is a contraindication. Then cerebral aneurysm, brain tumor, then acute myocardial infarction like that disease condition, retinal detachment, cognitive heart failure, congestive heart failure, then pneumonia or aortic aneurysm. This type of medical disorders they have means it is a contraindications of ECT. So ECT indications and contraindications are important area. Then complications, side effect, the role of nurse.
Yeah.
Role of nurse, when you are writing the role of nurse related with ECT, you can write like that, pre-treatment roles.
Okay, treatment evaluation. You see, these are going to be divided into in 3 phases. One is pre and another one is intra and post. Pre means before going to provide the ECT, whatever the role will be going to taken place by the nurse, that you have to write it. Next one, intra. During that ECT procedure, what is your role? Suppose you have to provide a care for the patient during that. Okay, so certain times they have to have the chance to bite the tongue.
The patient or nurse needs to stay with the patient due to the anxiety, fear. Okay, so that may be an.
So you have to have a role of educator. You have to educate them during the time. You have to provide a psychological support too. Okay, so those are the role and responsibility of a nurse. And then post. Okay, so after completion of that, what you
monitor the vital signs, then continue the oxygen supply it is needed. Then when the spontaneous respiration it will be started, up to that oxygen administration is needed. Then post confusion or restless, anything is there, they need to assess. So basic assessment is needed. You can write it with their own words, no issues.
Kannada explain, madam. Kannadallu heltivi once we'll finish.
Okay, so that is about the ECT. That is one of the important area. Then ECT may be a 5-mark question or essay question or a 2-mark question for tomorrow's examination. Then classification of 5th unit, classification of mental disorders. Then personality disorders related with the organic mental disorders, delirium, dementia. Delirium, dementia, it's also one question.
Yeah.
Last time also one essay question, then they will get like that, dementia.
Yeah. ಇನ್ ಕನ್ನಡದಲ್ಲಿ ಹೇಳ್ಬೇಕಂತ ಹೇಳಿದ್ರೆ ಈ ಎಂಟೈರ್ 5th ಯೂನಿಟ್ ಇದೆಯಲ್ಲ ಅದನ್ನ ಕಂಪ್ಲೀಟಾಗಿ ಓದಬೇಕು. ವೈ ಬಿಕಾಸ್ ನಿಮಗೆ ಇದರಿಂದನೇ ಜಾಸ್ತಿ ಕ್ವೆಶನ್ಸ್ ಕೇಳೋದು. ಓಕೆ, ಸೊ ಈ ಯೂನಿಟಲ್ಲಿ ಯಾವುದೆಲ್ಲ ನಾವು ಕ್ವೆಶನ್ಸ್ ಹೇಳ್ತಿದ್ದೀವಿ ಅದು ತುಂಬ ಇಂಪಾರ್ಟೆಂಟ್, ಎಸ್ಪೆಷಲಿ ECT. ಮತ್ತು ಇವಾಗ ಯಾವುದೆಲ್ಲ ಡಿಸೀಸ್ ಕಂಡೀಷನ್ಸ್ನ ಹೇಳ್ತಾ ಹೋಗ್ತೀವಿ, ಲೈಕ್ ಡಿಮೆನ್ಷಿಯಾ, ಡೆಲಿರಿಯಮ್. ಓಕೆ, ಸೊ ಬೇಸ್ಡ್ ಆನ್ ದ ಥಾಟ್ಸ್, ಮೂಡ್ಸ್, ಡಿಫ್ರೆಂಟ್ ಡಿಸಾರ್ಡರ್ಸ್ ವಿಲ್ ಬಿ ಅವೈಲೇಬಲ್ ಇನ್ ದ ಮೆಂಟಲ್ ಹೆಲ್ತ್ ಅಲ್ವಪ್ಪ. ಸೊ ಅದನ್ನು ನೀನೇನು ಮಾಡಬೇಕಂತ ಹೇಳಿದ್ರೆ ಒಂದು ಕಡೆ ಎಲ್ಲ ಒಂದು ಲಿಸ್ಟ್ ಮಾಡಿಬಿಟ್ಟು ಆರಾಮಾಗಿ ಒಂದ್ಸಲ recall ಮಾಡಿದ್ರೆ ಸಾಕು. There is no need of putting extra effort. For everybody I'm telling, list it down all the disease condition and recall it. Now it is the time for revision only.
Revision only. Again we are going to study. If you are going to study the entire syllabus means then we don't get the time.
You are not going to remember it also.
Simply read that one. Okay. Then in the management, personality, dementia, psychiatric disorders like schizophrenic disorders, mood disorders, BPD, that is also an essay questions. So here that repeatedly one question you may be got it from the when we are checking with the past question papers, we find that 2-3 times mood disorders will get like a repeated
last
questions.
Time also.
Yes, like question it is like that, define mania and explain the causes, types, treatment and nursing management of patient with a manic episode. That is one question. Then another one question it is like that, define mood disorders and signs and symptoms of mood disorders or especially from that depression, nursing management of patient with a depression. And that is 2 questions already that is asked from the previous years. Then one question it is like that, define BPD. What is BPD?
BPD, bipolar.
That is bipolar affective disorders. Bipolar affective disorder means include 2 major disease conditions. One is
mania and depression.
Yeah, one is mania and one is depression. That is BPD. Manic episode means the patient was too much excited and too much, they are very active. Depression means very like introvert. हिंदी एक्सप्लेन मैम.
हिंदी में ऐसा है, थोड़ा हिंदी आता है. ऑल डिसऑर्डर्स लिखने के बाद रिवीजन करो.
हिंदी मालूम नहीं. हिंदी
लिटिल.
If you are studying in Hindi, which language you are going to write exam?
इस लाइव को बता तू. I'm not knowing properly. Next time we will learn and come. Okay, so
we are trying to learn.
एक क्वेश्चन पक्का आएगा इस चैप्टर पे.
Wow. Second language Hindi.
Yeah.
Schizophrenia it's one of the area. In that schizophrenia, different types. ICD-10 classification. What is schizophrenia? It is a psychotic condition characterized by the disturbances in the thinking, emotions, violation, and faculties in the presence of clear consciousness with usually social withdrawal. Different types of schizophrenia are there. So in that, which is the main important question we need to expect, that is catatonic schizophrenia or paranoid schizophrenia.
Yeah.
Then their treatment modalities, ECD is also one of the best treatment modality.
Yeah.
Nursing diagnosis also
Yeah.
you can write. When
See,
it is
whatever the
like-
disease condition they will ask also, you have to write it down the nursing diagnosis. Okay, same like you have written in the MSN, right? So the
Yes.
same modality you use. Later we will tell about that.
Yes.
So far this over, and this unit only. Patients with the mood disorders,
Mood
disorders
disorder.
over manic episodes, bipolar affective disorder, depressive episodes, recurrent depressive disorder, persistent mood disorder, other mood disorders,
Unspecified mood disorder. These are the
according to
classification of
ICD-10 is there, no? So according to that.
if a BPAD patient diagnosis nursing, at least they need to write nursing management.
Yes.
So one nursing diagnosis, that is high risk for injury related to extreme hyperactivity. If the patient is manic, means we already mentioned that a patient was very hyperactive. So high risk for injury related to extreme hyperactivity and impulsive behavior, or high risk for violence.
Brief answer, Venu. Yeah, 1 second. We will complete after this. We will tell.
Which one brief answer?
This only.
BPAD.
Yeah. See, we are telling the nursing diagnosis. See, BPAD means a bipolar affective disorder. Mania will come. Mania, what is the symptom? Hyperactive. Okay, one example I will give. Person can, if he is not a healthy person, means we will go, how we will go with the stairs and all. We will go normally after one step, we will next step. Like that we need to move. But mania patient, what they will do? They will skip 2 to 3 steps. They will be like, they will climb like that. They will be very active. They will become like they will jump. So much of
That
activeness
means
will be there.
they are very hyperactive or elevated or expansive or irritable mood. They have.
Okay, so due to that, what it will be happen, the side effect is that there is a high risk chance of falling down or making any kind of fracture to their body. Okay, so this is the one of the nursing diagnosis. Remember, like that only you have to know the disease condition properly, means you can write the nursing diagnosis too.
Yes. Then other mood disorder, neurotic disorders, phobia, anxiety disorders,
Obsessive compulsive disorder, OCD.
depressive
Always
neurosis,
washing hands.
and dissociative.
Dissociative reactions, conversions disorders, and stress disorder, traumatic stress. Okay.
That means neurotic and stress related or somatization disorder. That is the next area in the unit number 5. Include the phobic anxiety disorders. Phobic, different phobias, then specific phobia, social phobia. Phobia means fear.
Fear.
Okay, that is
Photophobia, fear of light, hydrophobia, fear of water. Okay, so same like this only. We have lot of phobias. Okay, regarding that also, sometimes there may be asked in one mark question, what is photophobia?
What is this? What is that? Define the meaning like that. Then next area, that is panic disorders. It is also characterized by anxiety. Which is anxiety. Simply
suddenly something we can't able to tell to that person who is having a panic. They will be showing their
what are the clinical features? They have a shortness of breath. Maybe. Then rapid heartbeat, then choking, chest discomfort, pain, palpitation. These are the clinical features they may be facing for a person with panic disorders. Then it is a common name, panic disorder.
Don't be panic like that. In the examination hall, we used to tell, no, don't be panic. Always go with the
panic attack.
Panic attacks after seeing the paper.
Okay, then next disorders, substance use disorders. What is somatoform disorder? These disorders are characterized by your repeated presentation with the physical symptoms which do not have any physical basis or persist request for the investigation and treatment despite of repeated assurance by the treating doctors. Somatization disorders. Okay, one area in the essay question we couldn't able to tell from that.
Okay.
Okay, next is substance abuse.
Substance abuse is one of the very much important. Okay, so there alcohol.
Substance use, de-addiction include alcohol, tobacco and other
Rehabilitation.
psychoactive substances. Okay, so that is also what is dependence.
Yeah.
That may be one more question. Then tolerance, one more question. Withdrawal state. That is one more question. Okay.
You may see all those symptoms who underwent drug abuse, alcohol abuse. Okay.
So commonly used psychotropic substance, which are the commonly used psychotropic substances means
like
alcohol, then
opioids, cannabis. Okay.
cocaine.
So this one, Ultrastat is there, no ma'am? That drug. Nowadays, that drug was banned. Like previous 6 months back. Why? Because those drugs are having this drug content. Okay, so people are taking due to the purpose of that in the medical shop and they are consuming it. Same like that only. These are the opioids, cannabis, and this MFT and all will come now. So lot of things under the drug.
Alcohol dependence in symptom, one of the area we need to study. Alcoholism is refers to the use of alcoholic beverages to the point of causing damage to the individual, society, or both. Alcohol dependence syndrome, it is a psychiatric condition. It is a medical condition. Without the limit, they couldn't able to stop alcoholism. That is alcohol dependence syndrome. Okay.
Yeah.
So then other than that, opioid dependence syndrome is there. Then child and adolescent psychiatric disorders.
Child and adolescent psychiatric disorders, like sleep disorder will be there, and eating disorders, stress eating, especially in this nowadays lifestyle. Stress eating is one of the common type. And next one is sexual disorder. Okay, sexual disorders. So these are the 3 things which will comes under this.
ICD-10 gender identity disorders.
Yeah.
Gender identity disorder as per ICD-10 F6. Their disorders are transsexualism, gender identity disorders in the childhood, dual role. That is
dual role, like acting as a boy also, acting as a girl also. Dual role they are performing. And transsexualism.
Means it is characterized by wearing the cloth of an opposite sex. Male person wearing female dresses. Okay, that is gender identity disorder. That is also as per in ICD gender identity disorders. It is under the category of F6. Okay, so then sleep disorders. Okay.
Insomnia and all will be there. No, insomnia is one of the very important topic. You have to focus
another
on
that is eating disorder. Two most important eating disorder, that is anorexia nervosa and bulimia nervosa. What is anorexia nervosa?
Anorexia nervosa is characterized by highly specific behavior and psychopathological symptoms and significant somatic signs. Majority of females are the onset of during the adolescence. The core psychological here, what it will be happen?
Because they have the phobia to increase weight. So what they will do? They are trying to thin by their self. Mostly in the adolescence, they are more.
They have to maintain the fitness and all. So fitness is a different thing, but they want to be always thin. That is why they will not go.
They have an intense fear to becoming obese.
Obese.
So that is what is the complication? Malnutrition.
Yeah.
Then chances of making infection, chances of spreading infection, inflammatory bowel disorder. So when you get a question like that, eating disorder including anorexia nervosa or bulimia nervosa, you should add the nutritional plan. Okay, nutritional plan or diet plan.
If we don't know the answer, what can we write like common points for all?
Common points include nursing management. So nursing management, especially if you get a question like that, eating disorder. Two eating disorder are there. That is anorexia nervosa, bulimia nervosa. So they don't know nothing about that. But first you have to identify that is an eating disorder. Okay. Then under that you can write that it is an eating disorder. And you can add some nursing management and some health education, family education, and also nutritional or diet plan. You will get out of 5 1 or 2 mark.
Don't leave any questions, write it down and come, because that is the only reason to lose the first attempt. Okay, so this is your final attempt. Be prepared in your mind. Okay, so may I ask you something? Ask
Yes.
us.
Sleep disorders, already madam is told about these sleep disorders. Insomnia refers to the disorders of initiation and maintenance of the sleep. They are not possible to initiate the sleep and maintain the loss of sleep. That is insomnia. Nursing management, everywhere you can add nursing management, nursing process and nursing process recording, including mental and I am a new follower.
Okay, for this NARSET we will do one more live. Okay, da.
Okay.
Now we are
This is for the
conducting a
GNM
this
students.
one.
They have the exam. So mental health nursing examination preparation class. Okay.
NARSET later I will tell. Okay, so end of the live I will tell.
Okay. Next unit it is talking about biopsycho and social therapy, biopsychopharmacology and like psychosocial therapies, role of nurses in these therapies.
See,
okay,
we are
somatic
having
therapy,
lot of,
ECT, insulin therapy. So here a question it is like that, what is ECT? Then next unit community mental health concept, then signs and symptoms of mentally ill person, prevention of mental illness or preventive psychiatry. Okay, preventive psychiatry actually it is a branch of psychiatry. It has a vast area. And the next unit it is about psychiatric emergencies and crisis intervention. That is maybe essay question. There is also a chance for essay question. Types of psychiatric emergencies. What are the violent behavior? Then suicide, adverse drug reactions, withdrawal syndrome. Okay. Then crisis intervention, AIDS, adolescent crisis, these things you have to remember. Forensic psychiatry is the last unit. Malayalam.
Is it trick to write exam? Later on we will tell the trick. Okay. The trick is nothing. That is, everyone knows the trick, but we will explain you in writing how to write the
Then
answer paper.
last unit, that is forensic psychiatry or legal Malayalam explanation. Okay, so forensic psychiatry. In this forensic psychiatry, which questions? Rights of mentally ill patient. It is a question. Mental Health Act 1987 and 2014. That is also a question. So these are the main units. You
This
need
is
to
a
study.
syllabus we covered. Okay.
Yes, already they know. This is the supplementary examination. Last year something it is happened. That's why they got the supplementary. So this year everything it is fine and everyone will get pass mark. Not only pass mark, yes, first class.
Yes.
So mental health nursing. Now we are going to tell about some of the important questions. Just to check, confirm that these questions you are aware about these questions before going to the examination hall. Okay, some essay question, long essay questions, we can tell that. First one, define ECT and indication and contraindication and explain the role of nurse in doing ECT. Okay, that is explanations we given. Okay, next is define mania.
Define mania, explain the causes, types, treatment and nursing management of patient with a manic episode. Along with that, explain about the mood disorder, signs and symptoms of depression and its nursing management.
Yes, the BPAD. From that one essay question.
BPAD, full complete BPAD you have to study, means this one is easy for you.
Both depression and mania will get. Next question, that is about the psychiatric emergencies and crisis intervention. Define crisis and explain the types and techniques of crisis intervention. Explain the types and techniques of crisis intervention. Next, admission and discharge procedure of psychiatric patient. Or otherwise, the question it will be like that: the role of nurse during admission and discharge procedure. Nursing, mental health or psychiatric nursing, admission and discharge procedure, it is very important because of the legal formality. So you have to study that one. Then the unit, it is in that unit, therapeutic nursing, nurse-patient relationship, that unit is we are mentioned that one essay question we need to expect. That question, repeatedly asking that question, that is therapeutic nurse-patient relationship and therapeutic communication techniques.
Phases of nurse-patient
relationship. Phases of nurse-patient relationship. Then again it comes to the unit, which unit? When it comes to the substance abuse.
Okay, so
substance use disorders or types of substance, nursing management, symptoms of alcohol dependence syndrome. These are 2 times, within this 5 years, 2 times it will be get. Then frequently asked another one question is nursing management of patient with alcohol withdrawal symptom. Alcohol withdrawal symptom, it is important. Then again define BPAD or define mental illness, compare and contrast between mental health and mental illness. That is one question. Then therapeutic communication also we mentioned that one. Describe different types of psychiatric emergencies. Okay, so a nurse's role in the prevention of suicide. Mental retardation, classification of mental retardation and management of children with the mental retardation. That is also asked one question, asked like an essay. Then again short notes, again 2 more essays. What is prevention?
What is prevention? List the types of prevention. Explain the
secondary prevention. Explain the secondary prevention or preventive psychiatry. Preventive psychiatry and models of prevention and roles of nurse in the preventive psychiatry.
Yeah.
Then
we have the questions like
milieu therapy and who are the people
who form the team
in milieu therapy,
how it's
implemented.
How it's implemented.
Okay, different types of therapies. Then
the behavior therapy and all will be there. No, there only the one therapy they may be asked.
Then short note, principles of mental health nursing, phases of nurse-patient relationship, role of nurse in preventive psychiatry, and again 5 more questions we can expect, that is like that mental health program, principles of mental health nursing, that is a repeatedly asking question. And next is
anxiety disorders.
Next is discharge of the patient from the mental health hospital.
Lithium toxicity. This is very, very, very important. Don't forget to study about this lithium toxicity.
Again, mental health program, same like a mental health team. It is another one question. Next question.
Next one we have mini mental status examination
and also mental health act. Mental health act.
And we have the dementia.
When it comes to the disorders, dementia, childhood disorders,
mental illness prevention,
and somatoform disorders, delirium and dementia. Antipsychotic drugs. When the drug area, antipsychotic drugs and antidepressants are important. And one more question, what is phobia? Like questions also we need to expect from the MHN, mental health nursing. So that is about a lithium definition. Lithium, what is lithium?
Lithium toxicity. Okay, so increasing the lithium level.
Toxicity means lithium toxicity.
Harmful.
That is a drug.
So toxicity means harmful. Harm means increasing level of the lithium, which may cause the toxicity. Okay, lithium is a drug.
So hope you will get an idea about mental health nursing and what we need to expect for the tomorrow's examination. So anyway, you done the examination. Yesterday they have exam. Day after tomorrow also they have exam. Okay.
Now so, you people are asking about this one, right? How to write the examination.
How to write the examination? I think no need to explain because they are the second year students and they are writing too much of examination. And too many exams they are writing. So that is not an important understanding what are the questions you will get. Read the questions carefully, write the answer very neatly in your answer sheet. Okay, so overwriting, avoid the overwriting, and you have the answers thoroughly means what they need to write, underline the important points. If you don't know the answer, you have to study and go to the examination center. Okay, there is no objection, no consideration. You have to learn. Don't know answer means why you are going to the examination hall. No need. Okay, so these many days it is announced 1 month back.
Only they have
only announced the examination. There was no changes for the examination.
No, anyhow.
So you have enough time for studying. Why don't you study? You have to study because you are going to a nurse. You are going to a registered nurse in the future after 1 year. For irregular students, that may helpful. There is no irregular or regular students, only regular students it is there. Because GNM course, it is a regular course. Every students are regular only because in the future, you are going to work in the hospital. So in the hospital, you don't know one patient condition and how to treat means how the patient will believe. So that is the reason. Same like anatomy examination, tricky question. We are also expecting the tricky questions. That is important. Otherwise,
people will going to be not having any knowledge and working and getting a...
So that is very, very dangerous for our society because we are also responsible human beings. You are also responsible citizen. So that is the reason you have to learn. So every time we are also supporting the students to put some gas. So today onwards, I am also not going to support them because you have to learn. Okay. So and also in future, I found that the students are simply learning nursing.
Very easy only.
They are considering that it is a simple course. It is not a simple course because it has some roles and responsibility. One, we are treating one human being. Something it is happened for the human beings. It is not possible to replace. Some other engine or something means with any course we can replace. But it is not about like that. We are doing with the human lives. So thank you so much. Thank you. So you have to study. You have to study. So almost every facilities are available. Don't go with the previous year question papers. Learn with the syllabus. We are also doing previous year question papers. Just
analysis only for you to get past here because it is already
for boosting the confidence. We are conducting previous year question paper series. Okay, so don't study with the previous year question paper. Study with the syllabus. Study
properly because you know it is only the course. We have to show some passionate towards the course. Then only you can
because you have they have to understand the importance of the course. What is this? Nothing. It is same like MBBS. So MBBS students they are not studying means how we can go to hospital? We have fever. Means,
what is the hope? Go and meeting the doctor.
Go and meeting a nurse.
Yes.
Okay.
See, if you are not, your hand will shake. Patient will tell, ma'am, this nurse we don't want. Why? Because you don't have a confidence. When you will get the confidence? After
theoretic. And also I heard some of the students are telling the practical experience it is needed. Practical experience it is needed with the theory knowledge. Theoretical knowledge also important. Okay. So any questions you will get means you have to answer.
Yeah.
Okay.
Okay. So far we have
discussed.
So
I think the time it is also over. BPAD.
Yes, that
is not a BPAD. BPAD, bipolar affective disorders. BPAD,
including mania, depression,
not BPD. BPAD, affective. Okay. Ullas.
This Amrita asked.
Okay. So, lithium toxicity, one question.
Yeah, lithium toxicity. It is a condition caused by the excessive level of the lithium in the blood. Okay, so in the blood there is an excessive level will be there. Okay, lithium level once we are going to be.
So, therapeutic serum lithium level, it may be a question. So, 0.6 to 1.2. That is a therapeutic range of lithium. And overdose of lithium, that is known as lithium toxicity. Remember that one. Okay, that's it. Okay. So, hope it is useful. So, confidently. Go to the examination center tomorrow. I wish all the best for every students. So, you have the doubt means you can write it in the comment box. And if it is useful, share with your friends. For the third year also, you will conduct the live sessions. So, follow Nursing Guru official Instagram page and subscribe Nursing Guru official YouTube channel. And now also some of the students are there. They are not aware about the Nursing Guru. So, share with your friends. They will also learn from us.
Yeah.
So we can also, together we can learn and we can build a good medical
Community.
or medical
Nursing
professionals,
community.
professionals.
Yeah.
Okay, not like a simple normal nurses, nursing professionals,
professions.
qualified professionals.
Yeah.
Okay, so thank you so much. See you on next day. So
Thank
after
you.
that, tomorrow next live session is there. Next live session
It's
regarding
all
the
about the foundation of nursing.
fundamentals of nursing. So whole of the people are studying fundamentals of nursing. Keep watching. So thank you so much.
We
Thank
will
you.
wind up here.